Today, we're going to talk about a topic that affects millions of people around the world. Atrial fibrillation, one of the most common heart rhythm disorders. And about a drink many people can't imagine their morning without: coffee. For years, there has been a widespread belief: if you have heart problems, stay away from caffeine. It stimulates the body, speeds up the pulse, can provoke palpitations. But is that really true? Or have we become hostages to old, untested assumptions? And now, finally, we've got randomized data that lets us look at the situation clearly. And this data comes from a very authoritative source, the medical journal JAMA. And honestly, these findings may reshape our understanding of how coffee affects the heart. We're talking about a clinical trial called DECAF. Does eliminating coffee avoid fibrillation? Its goal was to find out whether giving up coffee actually reduces the risk of recurrent atrial fibrillation after electrical cardioversion. Or, on the contrary, maybe coffee isn't the enemy it was portrayed to be for decades. 200 adult patients took part in the study. The average age was around 69, mostly men, all with documented atrial fibrillation or atrial flutter. Every participant was scheduled for cardioversion, a procedure that restores the heart's normal rhythm. After that, they were randomly assigned to one of two groups. The first group continued drinking coffee, not by the bucket, not by the liter, just at least one regular cup a day. The second group had to completely eliminate every source of caffeine. 6 months with no coffee, no tea, no cola. 0 caffeine. And here's the key question: which option turned out to be better for the heart? The results were honestly unexpected. In the coffee group, recurrent atrial fibrillation or flutter happened in 47% of patients. In the caffeine avoidance group, recurrence occurred in 64%. In simpler terms, those who avoided coffee had noticeably worse outcomes. Statistically, this translates to about a 39% higher risk of recurrence compared to those who comfortably drank their daily cup. This isn't just an observational note or someone's opinion. This is a randomized clinical trial, the highest level of medical evidence. Why would this happen? There may be several reasons. Coffee isn't just caffeine. It contains dozens of biologically active compounds, antioxidants, polyphenols. They can influence inflammation, oxidative stress, and vascular tone. There's another factor. People who have consumed coffee for many years are typically adapted to caffeine. For their bodies, it doesn't act like a sudden stimulant. But abrupt withdrawal, on the contrary, can disrupt the usual balance, and that may have played a role. Either way, the study showed that giving up coffee after cardioversion doesn't provide any advantage, and may even be a worse strategy than moderate caffeine consumption. But let's be honest, this doesn't mean you can now pour 5 or 6 cups a day into yourself guilt-free, or replace medical therapy with coffee. The study looked at a minimum of 1 cup a day, and only among people who were already habitual coffee drinkers. High doses, energy drinks, concentrated caffeine, pills, that's a completely different story, and it wasn't part of the trial. There are also limitations. The follow-up lasted for 6 months. Long-term outcomes remain unknown. Most participants were older adults. Whether the results apply to younger people is still unclear. And the trial was open-label, not blinded, without placebo beverages. That's acceptable for this type of research, but some bias is still possible. Yet despite all this, one conclusion stands out. Moderate daily coffee consumption does not increase the risk of recurrent atrial fibrillation, and according to the data, may even reduce it. And now, an important point. These results don't mean that coffee is a treatment. They don't mean that people who never drank coffee should suddenly start drinking it.
And they certainly don't mean that coffee can replace medication, weight control, blood pressure management, or physical activity. But they do tell us one thing for sure. The myth that coffee is deadly dangerous for people with arrhythmias is falling apart. And now, patients who were afraid of every sip of espresso for years finally have evidence-based reason to breathe easier. So, if you have atrial fibrillation, have undergone cardioversion, and have always tolerated coffee without problems, a moderate daily cup may be perfectly fine, and in some cases, even beneficial. The key is to listen to your body, work with your doctor, and avoid sudden experiments without medical advice. Science moves forward. Sometimes it breaks old beliefs. Sometimes it forces us to rethink things that once seemed obvious. And that's good, because truth is always better than fear, myths, and baseless restrictions. Take care. See you in the next video.